Hi guys, hi. I want to talk to you today about ozone therapy, oxygen and ozone therapy, and why I'm such a big believer of ozone therapy and far infrared therapy. What do these things really do for the human body? So I will start with the facts that until the early 1920s, in the United States, ozone therapy was one of the known methods that was used during surgeries when they were amputating organs or when there was sepsis, when there was bacteria. They used ozone therapy as one of the treatments in the operating theater to kill viruses, to kill bacteria, to kill gangrenes. When pharmaceutical companies got into the business and they became bigger and bigger and bigger, ozone therapy was actually started to be pushed out. And so by the 1930s, ozone therapy was pushed out mostly from all operating theaters and they no longer were used. What is ozone therapy? I will show you so you get a little bit better understanding. So whilst we are going to talk. So ozone therapy consists basically of an oxygen machine. This is an oxygen machine. This oxygen machine, oxygen, comes to this ozone machine, and then the ozone machine pushes out oxygen that was ozonated. And that ozonated oxygen, in this case, would be connected. Let me just move this here. Make sure that you get to see it. So here, hold on guys, I'm just trying to do this so it will be more visible to you. So here is an ozone bed. And I would connect the ozone to this pin. Okay, I can't do it with one hand, but I will connect it to this pin, and oxygenated ozone would flow into this bag, into this bed. A person would be actually inside this ozone bag. They would be closed up, and the whole body would be treated with ozone, oxygenated ozone therapy. So they would get an ozone and oxygen together. That treatment itself is amazing because it destroys viruses, it destroys bacteria, it gets rid of a lot of negatives that are on the surface of our skin. In my scope of work, and because it is such a undefined treatment, because it's not a treatment that is sanctioned, but it's not sanctioned. And there are certain states in the United States where ozone therapy can be used. In my scope, in my license, I can use ozone therapy on clients and on patients only with an external treatment, which means that I could put a patient into this ozone bag and I could run the oxygenated ozone into the bag. That oxygenated ozone would treat the whole body. So if you have fungus, if you have yeast, if you have skin conditions that are not treatable, that people don't know what to do with, and medicine doesn't know what to do with, even with diabetic wounds, ozone therapy is one of the therapies that is known to kill and destroy bacteria and viruses and destroy gangrene as well. There are countries in Europe where ozone therapy is practiced part of medicine. And patients that have ulcerated wounds because they have diabetes, they go to clinics where, let's say, the toes or the foot, whatever it be, is wrapped in a very similar thing like this bag, is wrapped in ozone, and every day they sit for half an hour, the oxygenated ozone runs into the wound, it destroys the gangrene, and you eliminate amputations. Now, in my scope, I can only do in the external part. There are clinics, and I am very much in favor of those clinics, that do ozone therapy through blood. That means same thing like a diabetes machine. It takes the blood out. It goes into a special machine in a centrifuge where the blood is oxygenated. Same principle, oxygen, ozone. It oxygenates, ozonates it, and then the blood is brought back into the body. So the blood is like dark red usually when it comes out, and when it comes back, is ozonated, oxygenated, and it is bright orange red. And it kills so many negative, so many conditions that regular medicine doesn't know how to treat inside the blood. I cannot do it because that's not in my scope. I happen to know in Miami a clinic that does it, and then there's another clinic in Clearwater in Florida that does these ozone therapies. There are states, I believe there's New York, California, there are about 13 states that you can do it. What I can tell you is categorically, if you suffer, if you have skin conditions, if you have fungus, if you have yeast, if you have conditions that there is no help, that all these steroids are not helping, I wholeheartedly would suggest that you try to do this ozone therapy, that you come to the clinic, that you make an effort to come and do this ozone therapy treatments. But I don't do only the ozone therapy. I also do, when I do ozone, oxygenated ozone therapy for the body, I also do this, and I will show you. So this is a far infrared, this is a far infrared sauna. And this far infrared sauna, you see the black plates, they release far infrared heat. That far infrared heat penetrates into the skin, not like a sauna that goes just under your skin. Far infrared goes all the way about this much. It goes through the skin, through the bone, through the ligaments, and it goes all the way down and then heats up your skin, your muscles, your ligaments. And once it's hot, it then comes out. And when it comes out, it pushes all the toxins that are inside your body out. This is what far infrared sauna detox does to you. It's not a steam sauna, as you know it. It's a far infrared, it's dry. You go inside and it will take you a good 15-20 minutes before you start perspiring. Far infrared sauna is the same thing. Like if you would stand outside in the sun, you're very cold, and then after 15 minutes you start taking off the layers of sweaters and coats that you have because you warmed up. It's not that your skin is warm. You warmed up because the sun rays went all the way down through your skin, through ligaments, through your bones. And it warmed you up, and then the heat comes out, and then you feel warm. Far infrared sauna is exactly the same thing on the spectrum of light, like the sunlight minus the ultraviolet light, minus the negative light. The ultraviolet light, that's dangerous for our skin. There's no ultraviolet. There's only a light of heat that comes from this place that I showed you. So that's far infrared. Ladies and gentlemen, I was born in Czechoslovakia. At the time I was born was a communist country, but Czechoslovakia was always known as one of the country with a lot of healing spas. They had and healing waters that came from the ground. So they have spas for heart, they have spas for lungs, and they have spas for arthritis and skin conditions, different parts of the country. And alternative treatments were always a big thing in Eastern European countries and in Czechoslovakia. This is how I was raised on. Even under communist era, the government would give you once a year for 2 weeks. If you had a condition, your doctor would write, and then they would send you for treatment. in this path, and they were supervised by medical professionals. However, there was no Western medicine used. The medicine that was used were waters, mineral waters, different muds, ozone therapy, oxygen-ozone therapy, far infrared therapy. These therapies are not new. These therapies are coming into being in the United States because so many people are looking for alternative treatments because medicine doesn't have answers for everything. And let me just tell you, during COVID, the way I was able to work and never contract COVID, when I was in my Miami Beach Bay Harbor clinic, which is here, and my Noonan Atlanta clinic, was because I used oxygen and ozone in the air. So before every patient that came, for 15 minutes, I was running the oxygen and ozone inside the rooms, and I used the ultraviolet light. So I used the ozone, oxygen, and I will show you what I used. And this is something. Hold on, I will bring it to you. This is an ultraviolet light. This is a bulb. I just had to take it out. You can actually put this in any light. You cannot look directly because it's ultraviolet, but this ultraviolet light will kill any viruses, any bacteria. So during COVID, I used oxygenated ozone in the air, and it would just come. I would just let it run through these hoses. I would just turn it on, just like this. Look. And the oxygen is running into the machine, and the machine now, and it smells like ozone. The machine is releasing ozonated oxygen into the air. And I had this ultraviolet light on, and I would kill any bacteria, and any viruses. So I was very safe during COVID and that's how I was able to treat people because I cleaned before everybody and after, so of course after everybody. So I cleaned. And this is how I was able to stay afloat and not get sick, and people wouldn't get sick in my environment. But how? Because the oxygenated ozone was killing any viruses, any bacteria that were in the immediate vicinity where I was. And that's exactly what happens when you use the ozone therapy on the body, and you enclose the body in the ozone or in the chamber, and the ozone runs through. So anything that is on your surface of your skin, if it is negative, it will kill it. Now, I said that you can do it this way. You can do it also through the blood. And then on a personal level, personally me, but I cannot do it for anybody because in my scope, I cannot do it. But you can do vaginal or rectal insufflation of oxygen and ozone, which means that there is a cannula that's connected at the end of the hose where ozone and oxygen comes out, and you use it either through your rectum or use it through your vagina, and you do it for 2-3 minutes once a day, and anything and everything that is negative in your body, it will kill and it will destroy. I am a huge believer of this, and maybe that's one of the reasons, that I feel good that I mean generally I have good health because I believe in alternative ways of treating the body. Even this light that you see here, okay, this is a infrared heating plate. So this I use for patients, for clients that come. And when I want products to penetrate into the skin, I use this far infrared light. You can't see any light, it's just heat. But the heat soothes the skin and penetrates deep, 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 deep in, below the level of skin, below the level of muscles, ligaments, and flesh. It does the same thing as if you sit in the far infrared sauna. I do this for the face. For me at home, I have a far infrared mask that I put on my face. I cannot use it here because this is a personal thing. I cannot use it from person to person to person. It's not something that I can wash or sterilize. So I use this on my face for my skin. So anything that's on the surface of my skin, I will kill. I will kill it that is negative with the far infrared mask. So I am a huge believer in alternative medicine. Sure, conventional medicine has its place, but conventional medicine is not the only answer. And in many cases, when there are no answers for your eczemas, and there are no answers for eczemas, and there are no answers, maybe an alternative route is the route to go. And so I can only speak for myself. I can only speak for my personal experience, for the way I was raised in Czechoslovakia at the time. These are the treatments that I was exposed to, and I value these treatments. I value these treatments very, very much, and I forward and treat my clients and my patients exactly the same way I would like to be treated. And so, so I do ozone detox. I do oxygenated ozone detox, far infrared detox for the body. I do treatments for the skin. So I have many alternative treatments that I can do for the human body, for the human skin, which are not conventional and which are not the treatments that are used mostly in establishments and in clinics in the United States. One, because a lot of people don't know about it. Secondly, because it's not a huge money maker. So people will not bother with it. But there's very little education. I will ask you, how many hours of education does a physician get about vitamins and supplements in the United States in medical school? This much. Nearly nothing. No doctor that graduates knows about vitamins and supplements. They know very little. But if you take in reverse, if you take old schools and you take European schools, because supplements, herbs, vitamins were integral part of human beings and of well-being, people know and people are educated in schools about these methodologies of treatment and equipment. It's just the norm, but it's not the norm in the United States. And if somebody asks, okay, and you say, oh, Eva, but you mentioned diabetes and it can kill gangrene, why are they not using it? Because pharmaceutical companies pushed out ozone completely out of hospital and operating theaters. Why? I'll tell you why. Simple. Dollar amount. Do you know that amputating a leg of a person brings overall about $500,000 in money to different fractions of the process of amputation? The doctors, the surgeons, the hospital, the anesthesia, the prosthetic, the post-treatment, all the people that are involved in that amputation, the number is $500,000. Do you know that doing ozone treatments, you cannot patent the air. Air cannot be patented. So let's say that you make an investment of $15,000, $20,000 in equipment, okay? Like I showed you, the ozone machine, the oxygen machine, you make investment. But that's it. There's no more other investment, and you just reuse it and reuse it and reuse it, which means it's not a moneymaker. It cannot make you thousands of dollars. It can only make you $150, $200, $300. It can make very little money compared, and then you will cure the problem. And if a patient comes with gangrene and you treat them for 6 weeks and they come every day and then gangrene is gone, so there is no need for amputation. And there is in the United States, you have about, maybe today it's a little bit more, there's close to 200 physicians through the United States who all say the same thing, who know ozone therapy, who know what ozone does. And they say that if ozone was used on gangrenes and diabetic patients, 97% of all amputation would be eliminated, not necessary, because you would kill the gangrene and you don't need to amputate the leg, the toes, the foot, whatever it is. So there are doctors that understand it, but because pharmaceutical companies are so huge and so powerful, and they're all intertwined. Pharmaceutical companies are intertwined with everything. They own the insurance companies. The insurance companies own the banks. It's just like it's all intertwined. Your well-being is only as important as you can bring the dollar signs, what you can bring and make for them. And you cannot patent oxygen, therefore this has to be pushed out. There are countries, for instance, Cuba, communist countries, which are very poor, and they cannot afford all the equipment and pharmaceuticals that America does. These countries still use in the operating theater ozone and oxygen. Do you know that in Russia too, that if you have a patient and a patient has blood poisoning or sepsis, they will put through the vagina, they will put, and they go, let's say, to operate on the person with sepsis in the belly. They will put this cannula of oxygenated ozone 5 minutes or 10 minutes. It will run inside the body, and then they have a window of about 40 minutes where the 10 minutes of the insufflation of oxygen and ozone inside the body cavity will stop for about 40 minutes the progression of the blood poisoning and the sepsis. And a surgeon can go in, they can clean up all the sepsis, all the poisoning, take everything out, and then they sew the person up, clean it up, because they have a window of 40 minutes. Because the ozone therapy, the oxygenated ozone that was flowing inside the body, killed everything and stopped the progression for 45 minutes. But because ozone, oxygenated ozone, you are not allowed to breathe oxygenated ozone directly. It only has to be done through water or through earth. Therefore, the ozone should not be, you cannot put it into the nose or into the mouth of a person. That's not possible, because ozone, if you breathe it directly, is negative, and it's negative to your lungs. But it's positive on every other way. So therefore, you can do insufflation through your rectum, through your vagina. You can put it up in the air. You can prepare a patient for surgery, but just not breathing. So you put it inside the body, it's perfect. And this is why I say that there are therapies that are not necessarily conventional therapies, but that does not mean that they are not good therapies. Like, I'm a huge believer in vitamins and supplements. I take vitamins and supplements on a daily basis, and I feel the difference when I skip. So just wanted to put this out there, and if anybody hears about ozone, oxygen therapy, or you're interested to come and get the ozone oxygen therapy for your body and the far infrared therapy for your body, then just by all means give me a call. It's 305-864-3333. 305-864-3333. I'm a huge believer, and I know it works. Thank you. Bye-bye, Eva.